Welcome, Tammie Jackson, Vice President, Go-to-Market Strategy and Sales, TransUnion Healthcare, and recently appointed Chair of National Board of Directors for Healthcare Financial Management Association, where I actually have some friends there, some mutual friends of ours, really good people at HFMA, incredible work happening there. I want to first go, in regards to, you didn't first set out to work in healthcare. What was the impetus for you to get involved in this very big, very complex industry, and why is it so important to you?
Yeah, that's a great question, and I think it's an interesting one as well, because very few of us, I think, are in the places exactly by design. A lot of it is by default. Again, having been with TransUnion for many years, when I came on board, I was on the financial services side, and at that time, our office in Houston, Texas, was organized by industry. And because I was the lowest man on the totem pole, I was new, nobody wanted healthcare. And so I got it. And that's actually, I got involved with HFMA to get educated about the industry itself. And you're absolutely right, this crazy complex field, right? So when you start to think about why is it important to me, there's a lot of work to be done. And I find great pleasure in getting to solve some of these problems. And, I'm incredibly passionate about health equity and about addressing social determinants of health. And there's an opportunity for each one of us to do that kind of work from exactly where we're sitting. And so, even a lot of people don't think so, but there really is a very direct path to how you can foster and promote health equity, whether you're in patient access or revenue cycle or clinical teams, obviously. So that's the really important work that I enjoy doing.
I love it. And that is incredible work. And it is now even needed now more than ever, Tammie. And I couldn't agree with you more there. So, you also have been, as I mentioned earlier at the top of the interview, that you've been, recently appointed as chair at the board of directors for Healthcare and Financial Management Association. And your theme there for the association is bolder, brighter, better, that really personify HFMA and, of course, your members. What's one example of bold action within healthcare that you've taken note of recently?
It's interesting, bold, right? It's all relative. But one of the things I've seen most recently, and it's not incredibly innovative, but in fact it is bold, and that is how the entire healthcare industry had transitioned complete offices to work from home environments to remote environments. And they just, there was a trend to do that, but the pandemic just accelerated it. And I just think they didn't have all the answers or all their ducks in a row, and they're solving problems as they're going. And I say they because as a business partner, we have been remote for many years. And so even the folks that we had in an office, it was easy. We had the playbook on how to do that. But for many providers, they were doing that on the fly. And so, I think it's bold again because they weren't completely ready for it and they did it anyway. So technology, data security, all of that, they're solving for it as they go. And then I think it opens up not only competition for their own employees, but it also opens up, however, the pool of candidates that they can pull from around the country. And that enables them to get more competitive themselves relative to the skill sets they have on board, how they can respond to different problems, how they can be able to problem solve and pull from different parts of the country because they're tapping into that mind, that brain trust. So that's what I think has been incredibly bold over the last 18 months.
It has been. It's been wonderful to watch. We always think, and sometimes in healthcare, like, oh, it can't be done. We can't do this. We've always done it this way. And we've shown ourselves as leaders in this industry, and everybody who's been in this industry for a long time, we can in fact change course. We can do big, bold things. And so we should take a moment and celebrate it. I couldn't agree with you more, Tammie. Yeah. It has been awesome to watch so many different leaders on so many different, different spectrums of the industry stepping up, taking big, bold action to continue to move us forward, especially during times of crisis like COVID. So thank you for that. I'm right there with you. It has been phenomenal to watch. And also, Tammie, earlier you mentioned that diversity, equity, and inclusion are very important to you. And speaking of that, these are extremely, extremely important issues facing the healthcare industry today. And while awareness of these issues is critical, how do we move to action, Tammie?
I think that is the $1 million question, right? So I think, I think about this in two different ways. From a straight, DE&I, perspective, right? So from a corporate perspective, as an employer, how do I begin to create diversity, equity, and inclusion within my organization? That certainly, from the top down, sincere investments in doing so with training and awareness and data. And I can tell you, I've never been more proud of who I work for than I have been of TransUnion over these last 18 months. The way they have showed up in meaningful ways, in genuine ways, in vulnerable ways to be transparent about where we are and where they want to take us has been nothing shy of just incredible. So I would say that about my employer. But I think, as my theme this year at HFMA, which the chairs normally will identify, is leaning into that, right? So, but it is what I was trying to get at was, I wanted to be able to talk to people relative to what they could actually do. So maybe this actually does answer your question. How do we come to action? Because I focus more on the equity part of it, the health equity part of it, because that really is getting into, diversity, equity, and inclusion. And how do we address that? And how do we begin to respond to meet the needs of those individuals, regardless of their socioeconomic status or socio-demographic status? And so from a revenue cycle perspective, there are things that you can actually do in order to promote health equity and execute practices that will not exacerbate social determinants of health inequitably. Digital front door strategies, how can we create a system that is more financially attainable for everybody? Telehealth, how can we create something that's inclusive so that regardless of my socioeconomic or socio-demographic status, I can take part in that. I think all of those are things that we can do to promote equity. And that's really my goal this year, even as chair, to try to drive that message home.
Yeah, one thing I'm personally very passionate about, and it builds on what you mentioned, Tammie, is broadband. To me, it's just, I'm going to step on my soapbox for just a moment, so just bear with me. I just don't understand, as the wealthiest nation on the face of this planet, how do we not have broadband across this country? It should be just as common space as like water, right, and electricity. So, and I know we're getting there. I know there are a lot of people in that fight. Our CEO, Sean Lane, here at Olive, is wildly passionate about this as well, as we continue our march in creating the internet of healthcare for this country and for every member in this nation. But broadband, you want to get me fired up on equity, Tammie? It's broad access to broadband around this country. To me, that is critical, and I know we can get there if we continue to work together on it. That's for sure. So,
and to that point, I want to add to that just a little bit. I was at an HFMA meeting yesterday, and we had there was a panel discussion around best practices and so forth, transitioning your staff to work from home. And one of the individuals on the panel said a lot of their employees didn't have internet at home. And so if you think about that, even prohibits your ability to work. It's not, so again, it all starts to kind of, come together, right? It all kind of feeds into one another. And it's like that not only prohibits your access to healthcare through telehealth or what have you, but if we transition to more of a remote workforce, you're not going to be able to work if you don't have it. It's going to limit your potential to earn income. It's crazy.
Tammie, you have me fired up. I'm ready to rock and roll for you. You let me know. I'm standing at the ready here in Denver, Colorado. You need somebody to go fight the good fight around this. I'm right there for you and with you, because these are important and needed topics at this time for sure. So thank you for sharing that. Let's talk a little future state as well, Tammie. What's the biggest challenge that currently facing the healthcare industry? I know there are a lot, but from your perspective, what's the biggest challenge that we are facing and why?
And you're absolutely right. There are a lot. And so when I think about the biggest ones, I think staffing right now is amongst the biggest. And I think that starts to play into a lot of different areas. And so I think that starts to speak to the need to automate. And I think it'll help accelerate that trend, because I don't think that that's a problem that will be solved in short term. And so people are going to have to buy into how much can we automate to change the face of the workforce, to make sure we have enough staff. And then even so, that's just kind of on the administrative side, on the clinical side, and that's, you all are doing a ton of good work in that space. But then also on the clinical side, right, the staffing part, that's your whole supply, right? That's your supply side of the healthcare delivery system. And so I think that will start to lend again into, we're going to have to address social determinants of health so that we can push some of that care more upstream, so that we are reducing the demand, so that the supply and the demand will end up evening out. Because again, I don't think that's a short-term problem. We're going to be dealing with the staffing issue for a long time. A lot of elective surgeries, as of just recently, they're being canceled, of course, because of this new surge, but then also because they don't have the staff. So I think that's what the future is going to look like. How do we solve for that big problem?
That's a good perspective, and I couldn't agree with you more. We are working tirelessly here at Olive to continue to help solve for that as well. It's a big one, and again, I know we can get there when we start working together and we have some of the most passionate and brilliant minds in this industry and in this country. We can solve these things, but it's going to take all of us to come around that same table to figure it out. And so also, Tammie, let's talk a little bit about kind of the world that we're living in and that we have been living in, for the past year and a half, and that's with the pandemic. What have we learned from COVID-19 that should have a positive and lasting impact on our industry?
I think we've learned exactly how bold we can be, right? So we've learned that we can pivot on a dime, that we can make things happen. We can collaborate with payers to come up with creative solutions to solve, acute problems. We have, whether it's work from home or telehealth, all of that. I think that's an incredibly encouraging piece of data that we should walk away from this pandemic whenever we are able to walk away from it and reflect on with great pride. The other thing, though, that I think is a real opportunity, and it's a lesson learned, and it could be something that we grow from and it becomes positive impact. What the pandemic has revealed, it didn't create it, it revealed it, was these huge disparities in disease prevalence and mortality rates and outcomes. And it's not simply access to testing and vaccinations, although that's part of it. It's that, the outcomes that I was talking to a hospital not long ago, their lower extremity amputation rate is 2 times more for Black diabetics than it is for white diabetics. That's a real problem, and we shouldn't be okay with that. And, much like some of the tragic things that we've seen over this last 18 months, you can't unsee that stuff. We can't make believe we don't know that the risks associated with social determinants of health manifest themselves in that way, and not try to solve for it. And so I'd like to see that come out of the pandemic, that we say enough is enough, and this is not a good long-term plan for us as a nation, and it's not who we are as a society.
I'm right there with you. Again, Tammie Jackson, Vice President, Go-to-Market Strategy and Sales for TransUnion Healthcare, and Chair of the National Board of Directors for Healthcare Financial Management Association. Tammie, thank you so much for being with us today.
Thank you. I enjoyed it. Thank you.